Hello, how are you?
I'm good.
I wanted to report a case of coronavirus.
This is when I for reporting about issues concerning coronavirus.
Who am I speaking to?
I'm Jackson Jerome.
Okay. Now, what am I supposed to do?
Regarding what?
Coronavirus, I feel like I have the symptoms.
You see?
Like I have the symptoms.
That you're having symptoms.
Yes.
Now, we don't have any coronavirus in the country unless you tell us how you could have contracted the
Well, she laughed, and it's not quite a laughing matter if indeed there is an actual case. And it was, call it a drill, if you may, of how the responders would react in terms of making a call, a distress call, and the instructions that should follow. I'm not sure if any one of us have tried that number, but it is our duty as well as a media, hand in hand with the government, to work at informing the public. And I'll start with you, Sylvia, with this very important issue that is now a pandemic. Have we treated it with the seriousness that it deserves and done our job?
Well, I think this is an unprecedented health challenge. So as much as it may seem like we haven't done 100%, I just want to really appreciate the new CS, because he's really aggressively tried to address the issue since he came on board. It's just been a couple of weeks, but we see him every day trying to solve the issue. But in my opinion, there's a lot that needs to be done, particularly to inform the rest of Kenya exactly what is going on. For example, if you go to a village and talk about coronavirus, you might find people don't even understand what it is. So the communication that has been done, I think there's been some effort to send out SMSs and all that. Yes. But we need to remember that most of the country cannot read SMSs. We also need to remember that majority of Kenyans don't speak English. So if you're sending out an SMS in English, it means you're not actually reaching a huge number of people. So I think the communication strategy really needs to look at how to reach down to the mashinani. I am delighted to hear the CS talk about having activations in all counties, but we need to remember that you're talking about the cities and the towns. Who is reaching the ordinary mwananchi mashinani? How will the ordinary mwananchi mashinani know about that toll-free number? I know it's a difficult situation they were in, because if you're giving out a number and it works out that the number is not working, it means that there's a huge challenge. But I believe that was just a glitch. I believe the ministry has their heart in the right place, and I believe that they're doing the right things. However, it's not just about getting yourself ready medically. You need to look at the prevention side. What is happening on the prevention side? Until today, flights have still been coming in from all over the place. So I feel that while the Ministry of Health is trying to really, get itself organized, there is a side in government that is not doing as well to try and prevent the virus from coming in.
Yes, and for media, as a custodian of information for the public?
Yes, I think the media have done, I don't want to say they've done well. I think they've done their bit. But the challenge we have is that the other stories that are taking precedence over this very critical story. So, for example, the BBI story is taking precedence and the mind space and the time away from this very critical story. If we get one case of coronavirus in this country, nothing else will matter. Not the politics, not whatever is going on in terms of this succession battle that is going on. If we get one case of coronavirus, our country is going to just be in a mess. Because me as an ordinary Kenyan, I don't know what to do. So I think the media need to do more in helping Kenyans to understand what steps they need to take, just should the eventuality happen.
We've heard from a communication strategist who's also a journalist in training. Dennis, as a digital strategist, let me call you that, is the media doing its part in spreading?
All right, Mark, let me start by passing a word of condolence to the entire NTV family on the loss of Nzioki, the video editor here, poleni sana. Now, on COVID, let me first respond by saying this. When the same question was put to Klopp, the coach of the great Liverpool team, he said that, my work is to coach. And some things are better answered by medical experts, because my business is to coach. Having said that, Kenya has 18 entry points. As of this moment, the 18 entry points are manned, and there is thermal check for everyone getting into Kenya. In terms of bed capacity, level 5 and level 6 hospitals across Kenya have been asked to set aside at least 20 beds, and all of them have not only set aside but confirmed with the ministry that that has happened, and that's why you hear the minister saying that from tomorrow there is simulation happening in the counties. On logistics, in terms of drugs, that has been taken care of. If this moves to a level that it is declared an epidemic of high proportion, then there is also masks that can cater for every Kenyan already in stock.
That, yeah.
On March 15, that Sunday, all the 70 facilities that are currently prepared to handle this issue will be checked, and to check whether indeed what they have said is what is happening on the ground. And that now brings me to what the media needs to do. The media then needs to check whether the 18 entry points are there actually thermal checks. The beds you're talking about, the logistics you're talking about, the media needs to send a camera there, as opposed to turning themselves into Ruto dailies and trying to only cover what the deputy president is doing. Then finally, I've heard something about the insurance, an insurance story that has gone round, that insurance is saying they will not be able to cover this. I think it's important, again, for the media to look at what laws governs this, because it's not an epidemic until it is declared under Section 63 of the Public Health Act.
It's actually a pandemic now, so
pandemic,
that is beyond.
No, that's WHO.
Yes.
But it has to be declared by the minister under our laws. And that's my challenge to you, Mark.
And the World Health Organization, of course, the Ministry of Health, even in dealing with this particular issue, has been working hand in hand with the WHO.
Yes, but it doesn't mean that it overrides our laws.
So in your view, if the WHO would declare this a pandemic,
and then the Ministry of Health has to back that up with Section 63, more like the way you have to do a Kenya Gazette even after you have appointed someone. It doesn't necessarily override. I'm actually challenging you as media to look at what is the procedure of having this move into, and as a Kenyan government, has the Section 63 been applied of the Public Health Act? That's my challenge to the media, because we're discussing coverage. We're not discussing the pandemic and how it's treated, because that is not our province.
Yes.
So,
I mean, you call yourself system of facts. So it's about, I mean, if you go with the authority, World Health Organization, that is fact from them. You wouldn't really
I'll leave
dispute
that to your newsroom meeting tomorrow, because you're the media. You're not trying me to get into your media house.
No, I'm talking about, because they are a source. In telling these stories, we go by sources. And in this particular one, the WHO is a source. And it's not one to just
and I've told you, Mark,
wish away.
I've told you, Mark, I am not wishing away the WHO.
Yes.
They have declared this a global thing, and I mean, I don't
Pandemic,
take WHO lightly. Yes. I'm only asking you, if WHO, in the same things that you're asking me, if WHO has declared it, has the Kenyan government done applied Section 63 of the Public Health Act, which is what is required under our laws to get some things moving on? And by the way, I'm sure you haven't read Section 63 of the Public Health Act. Take some time after press pass, read it, then you'll understand what I'm saying.
Yes.
Then,
in this particular issue, because it seems you want to outshine someone in terms of how much you've read. I'm just going by the fact of WHO having declared this a pandemic, and the seriousness of it, and you can see the government is moving. So not getting lost in the detail of, has the government declared it in this particular way? They have already, they're calling in drills countrywide.
Mark, you are absolutely unfair to say I'm trying to compete or outshine anyone. I have no interest in outshining anyone. Why would I want to outshine anyone on COVID-19? No. For what purpose and for what good?
System your fact. You've
so
spoken,
finally,
yes.
to say that insurance policies are basically legal contracts. So it makes sense for them to speak about what they are speaking about. But what I'm trying to tell you is, for these legal contracts, for them to be effective, it is also application to the law. What stops someone going to court tomorrow using a section in our Kenyan law to say that this is not a pandemic? So basically what I'm actually challenging you to do is what media should do.
Yes, and it has actually, and we have spoken to IRA, who have confirmed that going by their rules and internationally, they, when anything is declared a pandemic, and we're going by their standards, and so if we diagnose a case in Kenya and it goes by the WHO standards, then it falls under that category of not being covered because of the risk